I will call the first presenter, Dr. Sameera Nayak. She will be presenting on outcome of universal eye screening of newborn in tertiary healthcare system.
Slide change, sir. There's one paper.
Yes, Dr. Sameera, please.
We are taking Dr. Sameera early because she has a small baby to cater to. So, with the permission of all the people and the presenters here, we are asking her to present first.
A very good morning to all. We know retinopathy of prematurity screening has fixed protocol, fixed guidelines. But what about babies who do not fall into ROP screening criteria? Are they all normal? We often see sight-threatening pathologies in newborn like congenital cataract, congenital glaucoma, endogenous endophthalmitis, retinal hemorrhages, and vitreous hemorrhages. With this backdrop, we did a prospective study titled Outcome of Universal Eye Screening in a Tertiary Eye Care Center in South India from April 2016 to March 2018 in 2 hospitals, a medical college and a corporate hospitals to include all types of babies. The objectives were to know the different ocular pathology of newborn and associated perinatal risk factors. All these babies were screened within 7 days of birth. We took detailed perinatal history, maternal as well as fetal history. A comprehensive eye examination was conducted by a trained pediatric retina specialist using 28 diopter lens and binocular indirect ophthalmoscopy. Appropriate statistical analysis was done using Stata 13. In this study, we included 1,795 newborns. Median paternal age was 28.3. Maternal age was 23.7. Birth order was 1.8. Median 10-minute Apgar was 8.5. Median age at screening was 2.67 days. 18.2% babies had some type of ocular pathology, the commonest being retinal hemorrhage. Other sight-threatening pathologies were vitreous hemorrhage, endogenous endophthalmitis, of prematurity screening has fixed guidelines, protocols. What about babies who do not fall into ROP screening criteria? Are they all normal? We often see sight-threatening pathologies like congenital glaucoma, congenital cataract, endogenous endophthalmitis, vitreous hemorrhage in newborn babies. With this backdrop, we did a study titled Outcome of Universal Eye Screening in a Tertiary Eye Care Center in South India from April 2016 to March 2018. It was conducted in 2 hospitals, a medical college and a corporate hospital. The objectives were to know the different ocular pathologies of newborn and associated perinatal risk factors. All these babies were screened within 7 days of their birth. We took detailed perinatal history, maternal and fetal. A comprehensive eye examination of the baby was conducted by a trained pediatric retina specialist. Appropriate statistical analysis was done using Stata 13. In this study, we screened 1,795 newborns. Median paternal age was 28.3, maternal age was 23.7, birth order was 1.8, median 10-minute Apgar was 8.5, median age at screening was 2.67 days. The 18.2% babies had some kind of ocular pathology, the commonest being retinal hemorrhage. Other sight-threatening pathologies were vitreous hemorrhage, endogenous endophthalmitis 4 in number, congenital cataract retinopathy, ROP-like retinopathy, etc. We did a multivariate analysis to know the associated risk factors, and we found retinal hemorrhages were associated with normal vaginal delivery with odds 10.1, and non-RH pathologies were associated with prematurity, consanguinity, low birth weight, and systemic abnormalities. 12% babies had some kind of systemic abnormalities. There was no adverse events during examination of these babies. So in conclusion, commonest ocular pathology in otherwise healthy newborn was retinal hemorrhage, which was usually got resolved in 3 months follow-up visit. Sight-threatening ocular pathology in otherwise healthy newborn was not uncommon during universal eye screening, which could be associated with prematurity, low birth weight, consanguinity, bad obstetric history, and systemic abnormalities. Universal eye screening may not be feasible in a populous country like India. So we propose to have a targeted eye screening of the newborn, so that instead of screening all the babies, if we can target the babies with risk factor of prematurity, low birth weight, and consanguinity, and bad obstetric history, then we could find sight-threatening ocular pathology. We can detect early and treat them early. Earlier, we knew that as per Rashtriya Bal Swasthya Surakha Karyakram, we have red reflex test to screen all newborn babies by the pediatrician. But red reflex test is sensitive 99% to detect anterior segment pathology, but it is not very sensitive to detect posterior segment pathology. So a detailed comprehensive eye examination for newborn is required, which may not be cost effective for a populous country like India, sparing a retina specialist or a pediatric ophthalmologist. So we propose to have a targeted eye screening of babies with risk factors to intervene in avoidable blindness. Thank you.
Thank you, Sameera. I just had one question for you. In your group of 5 babies, you have not really mentioned that newborns means preterm newborns or they are full-term newborns. That segregation is not there. Then there seems to be a little bit of a mix-up between what you say is newborns with ROP-like features or non-ROP-like features. And so could you just segregate that for us, please?
Yes. So in this cohort, we have 1,565 full-term babies and 230 preterm babies. Preterm babies who do not fulfill ROP screening criteria. So between 34 to 37, they are also included under prematurity. So 34 weeks gestational age to 37 weeks gestational age. As for ROP screening guidelines, we need to screen less than 34 weeks or equal to 34 weeks and 2 kg or less than 2 kg babies. So between 34 to 37, we still consider them as preterm babies, but they do not fall under ROP screening criteria. And in this cohort, am I clear, ma'am?
Yeah, but I mean.
So in this, we have.
Okay. No, just to add on to what Karobi said is, just to improve the paper, I think birth weight is very important. Birth weight is very important, which you have not mentioned in your
Can you
this.
project this slide? I have hidden
No,
purposefully
no,
one
birth
slide.
weight. No, I'm just telling you whatever I saw only. I can
This
tell
is
you.
the baseline characteristics.
Birth weight is important, and correlating birth weight with some of the abnormalities that you have seen, because ultimately you are saying that there is a higher risk in people with low birth weight, with a systemic abnormalities, etc. It will be interesting if you could, in your results, try to correlate those features with the birth weight, etc., so that you're able to get a better understanding.
Yes,
Yeah.
sir, we have correlated. Can you project the slide? Is there any problem? We did a multivariable analysis, keeping prematurity, birth weight, gestational age, and bad obstetric history, SPO2. All factors are actually we taken into consideration. We did a multivariable analysis, and we found that prematurity, low birth weight, bad obstetric history, suppose a mother is having more than 2 abortions, and babies with systemic abnormalities. All these factors are significantly associated with some kind of ocular pathology.
Okay.
So the odds are more. We did a multivariable analysis, but other factors like maternal age, paternal age, and suppose there are other factors. So those are not significantly associated. So
If
finally
I
we
can-
found that.
If I can interject, Sameera, I think you have to segregate your paper. Your paper is not clear at all, because what happens is that you have mentioned there are hemorrhages in people who had vaginal deliveries. That's not anything new. Because the child is coming by the vaginal route, you do get hemorrhages. Whereas the other things you have to segregate, whether the patient has anemia, the patient has sepsis, what is the reason for the endogenous endophthalmitis, what is the reason for the vitreous hemorrhage, is there any kind of blood parameters. All these segregations have to be done. You cannot only blame it on bad obstetric history or whatever.
We have segregated the entire cohort into 2 groups. One, pathology, only retinal hemorrhages, and non-RH pathologies. So RH pathology like retinal hemorrhages is associated with normal vaginal delivery, we knew earlier. Non-RH pathologies like endogenous endophthalmitis, cataract, glaucoma, other things are associated with prematurity, low birth weight, consanguinity, and bad obstetric history that we found in multivariable analysis.